Today, I'm joined by Dr. Terry Wahls, who needs no introduction in the multiple sclerosis community, so I won't give an introduction except to say she has recently published the WAVE study, the first ever randomized study comparing two diets to treat multiple sclerosis, the Wahls Paleo type diet and the Swank low saturated fat diet. Thank you for taking the time to do the interview.
Oh, great. Thanks for having me, Brandon.
I was trying to look up the numbers of Iowa for the COVID-19 pandemic, and there's nothing to be found. Hopefully things aren't too bad out there.
Well, we have about 40 people in the hospital at the university right now, so we have more than what I would like.
Well, I think it definitely teaches us that general health is important because you never know what's going to come. And one thing we've seen time and time again is, generally people who are in good health are at much lower risk for severe COVID-19, and nutrition is always important in everything, not just for MS.
Absolutely. Absolutely.
So a lot of people know who you are, they know about your story. So what motivated you to do an actual randomized trial comparing the Wahls and the Swank diets?
Well, when I had my remarkable recovery, Brandon, from, 4 years in a tilt recline wheelchair, my chief of medicine, who was a rheumatologist, when I first went in to chat with him, he said, "Terry, this is so remarkable. Do a case report." And I said, "Like on myself?" He said, "Yeah, no, this is really important." So I worked with my treating neurologist, my treating physical therapist, and we wrote up the case report. And by then I was doing things in my clinics, and he had me write a little case series. And then he called me back and said, "Terry, I want you to do a safety and feasibility study to see if others with progressive MS could implement this complicated regimen that you did and what happens." So we did that, and we enrolled others with secondary and primary progressive MS. And we could show that, yes, they could, meditate, they could exercise, they could do electrical stimulation of muscles, and they could adopt, basically the Wahls diet. And that they had remarkable reduction in fatigue, improvement in quality of life, and half of them had clinically meaningful improvement in their walking ability. And as a group, they stayed flat in terms of their walking ability. And so my neurologist, my neurology team, and my chair of medicine were very, very impressed with that safety study. Then we did a couple small randomized controlled trials. Again, with very small numbers, because this is all being done by philanthropy, and those studies were promising. Then we'll secure funding from the MS Society, and I was able to do this much larger randomized study. At that time, because we know that patients who want to be in a dietary intervention study, nobody wants to be in the control arm. They all want the intervention. And you're asking people to do something that's really hard, to give up their usual diet, their familiar foods, familiar recipes, and to start new foods, new recipes, and give up perhaps some beloved foods. So you're asking a really big change. And so we proposed a parallel arm study that compared the Swank and the Wahls diet, and we controlled it by having an observation period because when I did my other small randomized controlled trials, I realized everybody wanted to be in the intervention arm. If they're in the control arm, they all dropped out. So the way to keep people from dropping out is say, you all have to be in the observation arm first. And so you all get to be your own control. We will monitor your fatigue, your quality of life, your motor function for 12 weeks while you're eating your usual diet. Then we'll randomize you, and you're going to be on diet 1 or diet 2. And we'll give you some support to learn this new way of eating and shopping and all that stuff. And then we'll bring you back and repeat all the measures. And then we'll have you continue with from us to see if you can keep it up. And we'll bring you back and repeat all the measures again. And fortunately for us, the MS Society said, "You know what, we like that study design." And so they gave us $1 million, and we were able to do that study.
Yeah, I like that design because it's not like I'm going to advise that a patient eat a lot of processed food. Of course, I'm going to advise at least a generally healthy diet, and we just want to know, is there something more specific we can recommend? So obviously a lot of people are familiar with the book, The Wahls Protocol, and it's pretty complicated. You talk about 3 different diets, the Wahls diet, the Wahls Paleo, the Wahls Paleo Plus, and you give a lot of different recommendations. We won't get into it. I do have a video on it in the card above if someone wants to check it out.
Good.
But, my reading of the study is it's kind of most similar to the Wahls diet, like the least strict of the diets. Is that accurate or
Well, actually, it's probably more like the Wahls Paleo in that, we stressed some animal protein, 6 to 12 ounces of meat, lots of green leafy vegetables, lots of cabbage, onion, mushroom family vegetables, deeply colored things like carrots, beets, peppers. And for 12 weeks, we asked people to take out nightshades. And that's because some people, we didn't want to do any fancy food sensitivity testing, but we took out the foods that have the most common unrecognized food sensitivities. After 12 weeks, we asked people to bring back the nightshades in one at a time. So bring back the potatoes, the peppers, the tomatoes, the eggplants, 1 ingredient per week. So we could get people to the least restrictive diet. And then the Swank diet it is a low saturated fat diet. It's a very heart healthy diet in that sense. It's less than 15 grams of saturated fat. So a lot of poultry, breast, chicken breast, turkey breast, white fish, no red meat. You aren't using butter, bacon fat. If you're having milk, it should be skim milk and skim yogurt and skim cottage cheeses. We improved the quality of the Swank diet because we went with the diet as it was interpreted by this Swank.org. So they have sort of been influenced by my work. So they are now stressing eat more fruits and vegetables. So the Swank folks, we said, yes, 15 grams or less of saturated fat, poultry, white fish, but have 4 servings of fruits and vegetables. And then on mine, we wanted to have 6 to 9. If you're a guy like yourself, Brandon, you would have been 9 cups of vegetables. But for the women out there, then we're talking about 6 cups. And that's measured before you cook it, by the way.
Yeah, and I know you tried to make things fair where both groups took the same supplements. Can you tell us? I know it wasn't really part of the study since both groups take the same.
Yeah.
But can you tell us what supplements
Sure.
you would generally recommend?
So we checked everyone's vitamin D, and if they were vitamin D deficient, we notified them and their treating neurologist right away. And we wanted people on 5,000 units of vitamin D, and we adjusted that a little bit depending on their vitamin D levels. We also gave them a multivite, multimineral, and a methylfolate, methyl B12, and fish oil, or cod liver oil, rather. And that was really a hybrid of the 2 supplement plans in terms of what Swank recommends and what I end up recommending.
All right, it sounds very reasonable. And, so I know one of the challenges with diet is it's just hard for people to comply with diet in general. A lot of studies with weight loss and, treatment of heart disease show good success over a short period of time, but it's kind of hard for some people to stick with it. What did you do differently than maybe what I'm doing to try to really get people on the diet?
Oh, sure. Well, so the first thing is we spend a lot of time asking them, what is your why? Why? What do you want your health for? And so we have people visualize their why and ask them, when things get difficult, what will keep you motivated to keep working on this? And for example, it might be that you want to see your child graduate from high school, or watch your son or daughter graduate from college, or enter into their wedding. So we help them identify their why, have them tell us what's going to help you when things get tough. And then we also help them understand the diet, give them recipes, menus, and tools to make it easier to implement this new way of eating. Because most of us eat familiar meals. There's maybe a dozen, 2 dozen meals at most that most families cycle through. So helping them find recipes that they enjoy, food swaps to take what had been a favorite meal and how we can reimagine that now with a Swank flavor or with a Wahls flavor.
Yeah, I think that is definitely a big challenge. And I think you guys did a pretty good job. I looked at the adherence numbers, and definitely most people seem to stick to the diets.
Yeah, I think people did really very, very well. And that's actually, Brandon, that's been true of every one of our studies, that we've had remarkable adherence. And if you look at the change in the diet from baseline in terms of how many servings of processed foods, added sugar, grams of fiber, servings of vegetables at baseline, and how many servings of all of those things at the end of the study is really, we've been very successful at sustaining change. And in the studies that we have had longer duration of a year or 3 years, we've been very, very effective at keeping people adherent to their assigned diet.
I think that's definitely key in the long run. Now, people want to hear the results, which we'll definitely talk about, but I just want to talk a little bit about the methodology. When I posted this on Twitter, you have a lot of people who love you, but there are always going to be people who don't like you so much.
Yeah.
And so people said, well, this study is biased. Dr. Wahls, she's the first author, So I know you did a lot to try to make this study as fair as possible, to have blinded assessors. Can you talk about that a little bit?
Yeah. So the first thing I want to say is all scientists, if we're developing a new drug, that is a investigator that has bias. And so the university here at Iowa, and every university, would have a conflict and interest research committee that's going to look at the declared interest and then work with that investigator. What are your roles? And what consistently happens is the investigator has no role in data collection, statistical analysis, and if you're involved with a clinical study, so you would be involved in conducting the experiment, consenting patients. So in our case, we again put everything through the conflict and interest committee. So I had no contact with the study participants, no involvement in the assessments, no access to data. Our statistician, we had one statistician who prepared the data for the Data Safety Monitoring Board, and then who cleaned the data, a different statistician who analyzed all of the data and did not have the key to diet assignment. So you cannot have a more rigorous study design in terms of bias than that.
I think you did everything you could reasonably do.
And Brandon, no one else is going to investigate the question, does the modified paleo diet work or not?
Yes.
Just like if you create a new chemical that you think may have a favorable impact on disease pathology, that inventor is the one to do the first round of experiments. So you just have to manage the conflict with a conflict and interest research committee that will oversee that, to be sure that bias has been addressed.
Yeah, everyone wants to, produce good results of their study, regardless of what the study is on.
Yeah, absolutely.
So with that in mind, with no further ado, can you kind of talk us, what were the key results of the study, would you say?
Okay, so we brought folks in. We had 95 folks that we consented. We got baseline assessments. And then when you let them know everything that they're going to need to do and be observed for 12 weeks with their usual diet, weigh their food, and for a variety of reasons, people drop out. And so we ended up consenting 87. So 87 got randomized. And then we got 77 to 12 weeks, 72 to 24 weeks. And what we see is, for the primary outcome, which was change in fatigue severity scale score, and that was the fatigue measure that looks at the patient perceptions of their fatigue. There was statistically no difference between Swank and Wahls. Both improved. Swank improved actually a little bit more than Wahls. But statistically, they were equivalent. But it is important to know that it was clinically meaningful reductions in fatigue. And so that's very exciting to me, that whether you're adopting the low saturated fat diet or the Wahls diet, we're having favorable outcomes for fatigue reduction. Our secondary measures were a more sensitive fatigue scale, the modified fatigue impact scale, physical health and mental health quality of life, the MS-54 quality of life measures. Now, for the more sensitive fatigue scale, the modified fatigue impact scale, the Wahls group had a greater level of fatigue reduction than the Swank group that was statistically significant at 24 weeks. But, Swank was also had more reduction in fatigue at 24 weeks. And both Wahls and Swank had further reduction in fatigue with a fatigue severity scale score. So that's very encouraging. The quality of life measures, the mental health and physical health at 12 weeks, Wahls was greater than Swank for both measures, and also at 24 weeks. Now, Swank did have clinically meaningful improvement in physical health quality of life. Then at 24 weeks, they had statistically and clinically significant improvement in quality of life for both mental and physical health. In the level of improvement in quality of life was a scale of 14 and 17, which is really quite remarkable because the clinically significant difference is only 5. So that's a very large improvement. And I think part of that is probably a reflection of the significant reduction in fatigue that people experience by adapting either the Swank or the Wahls diet.
And then I think there were also like the 6-minute walk data.
Oh, yeah. So now it's interesting. We had people wear actigraphs to measure just how much activity that they had during the day. But we also told them, don't add any new exercise program because we're trying to do a diet study. So we don't want you to, if your physician gives you a referral for physical therapy, by all means go, but don't start a new exercise program. And so based on their, we're not surprised at 12 weeks, there really was minimal change between how far their walking endurance, how far they could walk at 6 minutes. At 24 weeks, the Wahls group did walk further, and they now met clinical significance. And there was a trend towards statistical significance between Wahls and Swank. The p-value is 0.08, so it doesn't meet the 0.05 value, but it did meet the clinical significance in terms of walking endurance. And ideally, in my clinical practice, Brandon, when I talk to people about managing their MS, I'm talking about diet, I'm talking about exercise, I'm talking about a stress-reducing practice and paying attention to sleep. So in clinical practice, and I'm sure you're doing the same thing as well, we're asking people to address as many of their self-care routines as they can begin to address.
Yeah, and I understand with the study, you kind of want to focus on one thing just so you can analyze that one factor.
Yes. Although, I actually am very excited to see that now there are more studies that are embracing the multimodal approach that I did with my first study. And so we will be proposing a study, and we keep proposing it and more hopeful that we'll get funded for a study that includes diet, stress reduction, and exercise.
Yeah, and I think that makes sense. If you look at like Dean Ornish's work on heart disease, it was very multifactorial, not just diet. One thing just looking at the data I thought was maybe most impressive was, like you said, the difference in fatigue, very similar to what's achieved with drugs like Provigil. And I know you had a similar experience that you wrote about in the Wahls Protocol that, the diet was so good in terms of fatigue, you could stop your medication.
Yeah, I quit sleeping.
You were
I just said, you have to stop the Provigil.
All right. So kind of putting it all together, that's a lot of data. What's kind of the takeaway for people with MS? What do I need to know based on this study?
What you need to know is the standard American diet, the usual diet, people don't have any improvement in fatigue or quality of life. Either doing the modified Paleo diet or a low saturated fat Swank diet led to improved fatigue, quality of life. And so if people are more inclined and more curious for the Swank diet, by all means, they should do that. If they're more curious and inclined to the Wahls diet, they should do that. And I'll also throw out there, if people are more inclined to the Mediterranean diet or towards intermittent fasting, if that's what you as a family want to do, that's what I'd have you do. Because in my clinical experience and in our research experience, those participants and patients who do these dietary changes as a family are very successful. Those who do it only as the participant or the patient and the family keeps eating the standard American diet, they struggle and they invariably go back to the standard American diet. Now, my perspective is, I think you'll get a bigger effect with the Wahls diet, but if that doesn't speak to you and that's not what you can sustain, pick a dietary pattern that you can sustain and you'll be much more successful.
Like compliance in the long run is more important than the details of the plan in some cases. If you don't stick to it, it's not going to work anyways, basically.
When I talk with my patients, Brandon, and I may tell them that diet XYZ is one that I think is most therapeutic. But then I'll ask, do you think you could do that? Or do we need to negotiate a smaller intervention that you could actually be 100% good at doing? And we could just gradually step into the diet plan that you can actually implement as a family. I would much rather people be 100% successful at the plan that they and I agree on.
Just so they don't become discouraged and quit entirely. It makes a lot of sense.
Correct. Just make changes incrementally at a pace that you can be successful with.
So I thought it was a great study. I mean, it's very difficult to do this type of research. I give you a ton of credit for it. Do you have any plans going forward? I know you've done a lot of studies. Is there any next step for you? Well,
we have a couple studies in front of our IRB that I'd love to tell you about. One is to evaluate a online course that we have to teach people about diet and wellness. And so I'm hopeful we'll be able to launch that later this fall. Another study, again, that we have in front of the IRB that we'll be launching is a Wahls diet versus a ketogenic diet versus dietary guidelines. In that study, I'm very excited. It's going to be a 2-year study and will include MRIs in addition to some biomarkers as well. So we're very excited about that.
Yeah, I think 2 years is great because, looking at the literature of Roy Swank and your own experience, it does seem like, some of these diets may take some time to have an effect. So we shouldn't necessarily expect otherworldly results in 6 months. It may take some time for a lot of people.
Yeah, in the studies that we have done that have lasted 1 to 3 years, most of the motor changes did not occur until 1 year. And that was in the folks in the with secondary and primary progressive MS. You can get fatigue, mood, quality of life changes fairly quickly within 12 weeks. And that's typically what I see in my clinics, whether they have MS or other autoimmune issues. But motor changes requires physical exercise, rehab. It's a much slower, longer process.
Yeah, I mean, it makes a lot of sense that it just takes some time to reform those synapses. Now, you're welcome to talk about this as much or as little as you want to, but, you published the Wahls Protocol in 2014. It's a great story. How have things been since then? How have you been doing in general?
For me?
Yes.
Oh, yeah. Spectacularly well. In 2007, I was so weak. I could not sit up as I am here, and I was having progressively severe trigeminal neuralgia. I was beginning to have brain fog. And that's when I integrated what I read in basic science, functional medicine, and created this intensive diet and lifestyle program that a year later, I'm biking around the block, then biking 8 miles and biking 18.5 miles. Since that time, I've continued to do well. I continue to hike. I continue to bike. I broke my wrist biking, unfortunately, so that was sort of a bummer. My perception, if you look at photographs of me from 2009 currently, you'll also see that it looks like I youthened. Although I think I'm now beginning to age again, my hair is getting gray. So I'm no longer youthening. I'm back to aging, but I continue to do very well. It is interesting, Brandon, in that if I am exposed to the 3 foods to which I am quite sensitive, gluten, dairy, or eggs, that if I eat any of those, in about 6 to 24 hours, I can get twinges of pain in my face, and I'll get some electrical zingers from my trigeminal neuralgia, which I have come to appreciate as a terrific biosensor of how happy my microglia are in my brain. It keeps me feeling very attentive to my diet. It also keeps me very attentive to, am I meditating enough? Am I doing my exercise? Am I taking a walk every day or not? Because I'm ambitious. I have a lot that I want to do, and it can get very tempting to let all that I want to get done in the day crowd out my self-care routine.
Yeah, and I think we all need a little reminder to be focused on nutrition and lifestyle. It's been a tough year. A lot of people have gained the COVID-19. And I've fallen off a little bit myself, used to be a bit healthier. So it's definitely important to have a reminder sometimes. Do you have any other general wisdom for people with MS?
Well, pay close attention to your MS symptoms. And whenever you feel like you're having a flare of your symptoms, whether it's a sensory disturbance, a motor disturbance, visual change, or if your spouse says that you're having a change in your mood, there's 2 steps that I invite all of my patients and followers to do. Step number 1 is to look at what might the trigger have been. Could have been a food problem, a stress problem, a recent infection. And so what was the trigger? And then the second, address the trigger as well as you can. And then the second step is, so how am I doing on my self-care? Have I slacked off on my self-care? Have I let the busyness of my day crowd out my meditation time, my exercise, and I need to do a better job of my self-care? And if you'll take the time to notice your current symptoms, and then step 1, was there a trigger that I could address? And step 2, how's my self-care routine? You will get wiser and wiser and wiser. And I predict eventually you'll come to realize that those subtle symptoms, whether they're sensory or motor, will be very helpful reminders to really prioritize your health and your self-care.
I think it is very important to kind of pay close attention to yourself. But anyways, thank you so much for taking the time to do this. I really think Wahls is a landmark study. Hopefully we see more of this going forward. I hope it gets the attention it deserves. And
we have a couple more manuscripts that we are writing. So there'll be probably 4 more manuscripts come out of this data set.
I will definitely look out for it. Best to you and your family and your community.
Thank you, Brandon.